I'm Dr. Karen Parmar. I'm a naturopathic physician and co-founder, director of Integrated Health Clinics here in South Surrey and Fort Langley, BC. I've been working with women who have been suffering from recurrent loss and miscarriages. I feel it's a tragedy that a woman has to have 3 miscarriages before they get a proper workup here in BC. They are very traumatic events, and to get a workup, to have the blood work done that is necessary to evaluate it properly, there has to be 3 different miscarriages that are documented by a physician, and I feel like this is really a tragedy. In my opinion, when a woman is suffering from recurrent loss, there's a few key things that should be evaluated. One, of course, could be chromosome abnormalities. That's a bit of a tricky one. It requires products of conception. However, that is one to be considered. Some of the other things that I don't think are really worked up initially or perhaps even adequately are autoimmune diseases or a reproductive immunological cause for the loss, and also clotting factors and whether or not the woman suffers from a little bit of stickiness in her blood. Pregnancy is a hypercoagulable condition, and if you have a tendency to have a little bit stickier blood and clot a little quicker, that can make it really difficult in the first trimester to hold a pregnancy. So my practice has predominantly been around fertility and treating patients who are having trouble conceiving, and that's been since 2000. But in the last 10 years, I've really focused more on preventing pregnancy, and in particular IUD insertions. 2 reasons. I think if you focus on reproductive health, you need to help women who don't want to get pregnant too. Every day a woman wakes up and says, okay, today I want to get pregnant, or today I don't want to get pregnant, and equally as important and make a huge impact in their life. So a lot of the options in long-acting reversible birth control prevent ovulation. So all the oral birth controls, the Depo-Provera shot, the Nuva ring, they all work by preventing ovulation. And when you do so, the ovaries stop doing what they're supposed to do. So of the IUD options, you have hormonal and you have copper, and you have a high dose hormonal and a low dose hormonal, and then of course no hormones in the copper. My 2 favorite are the copper and the low dose hormonal IUDs. Reason being, very little side effects and equally as effective. And when you use a low dose hormonal IUD, you get a very light period. The copper IUD as well, no hormones, no change to your cycle. I prefer to use a silver core copper IUD. That's what I use exclusively. A lot of the other copper IUDs, actually all the other copper IUDs except for this one brand, have a nickel core. And a lot of women have nickel sensitivities. You know this, you go to put on fake jewelry and your rings and your fingers get itchy or even can even turn color. That's a nickel sensitivity. And a lot of copper IUDs have nickel cores. And I think a lot of the extra bleeding that is associated with copper IUDs is because of that nickel core. So my favorite IUDs are the silver core copper IUDs and the low dose hormonal IUDs. So of course, the most common question asked about IUD insertions is, do they hurt? Yeah, they can hurt. There are a lot of horror stories out there about them hurting a lot, but they don't have to hurt. You have to take a few extra steps. There's medication you can take beforehand to soften up your cervix and open it up, which makes the insertion a lot easier. And I freeze. I do a local block on the cervix, which then all you feel is some pressure and a little bit of sensitivity, of course, when I touch the top of your uterus or put the IUD in. But they do not have to hurt. A little bit extra time and care needs to be taken to make sure that you are prepared, and the freezing helps immensely. If you're interested in making an appointment for any of our services, just call the clinic or email and we'd be happy to help you out.